Hello everyone, I'm Dr. Dustin from Chiropractic, located in Cottage Grove, Minnesota.
I am Dr. Brandon with Twin Cities Movement in Uptown.
Alright. So today we're continuing our Mobility, Stability, Strength series. Today we're going to kind of work on a little bit of a combo of mobility and stability. We're talking about hip hinge. It's a very important movement that many of us don't do very well. Before I learned it, it was something I was horrible at. And generally we find areas of pain are usually the ones that are overworking, and they're compensating for another area that is underperforming. So today we want to work on getting the hips to move properly so we can take some of the strain off of our low back. Quite often, pretty common complaint we see as chiropractors.
Definitely.
Kind of what we're known for. So teaching people a hip hinge. So we have a just cardboard tube here. This also works with a broom handle. So we want to hold this key thing against your head, in between your shoulder blades, and then kind of tailbone in between the buttocks, right on your sacrum. So we're going to demonstrate a hip hinge here. So you'll notice that Dr. Brandon's lumbar spine is staying nice and neutral here, and coming back up. Now we're going to have him demonstrate a bad position. So this is how most of us move anyways. We see how the tube comes off of the low back glute area. So here we can see all the motion is coming in his lumbar spine and he's not hinging at the hip. So let's go back to doing a good one. Nice neutral spine, keeping nice and locked. Sometimes when I teach people this initially, I like to have them brace their core, so we can do like a hiss sound, and that tightens up all the way across the transverse abdominis, getting that nice and locked, and then doing this motion, hinging at the hip here, and coming back up. So this is a very important movement when doing squats at the gym, but also anytime you sit down in a chair, going to the bathroom. These are all movements where we are essentially doing a squat and we want to do a hip hinge to have a good movement pattern so we're not bending at the lumbar. We want nice and movable hips, but stable spine. So key things on that would be, what do you think?
Don't bend your lumbar spine.
Don't.
When you're loading it anyways.
Yep. Keeping it stable, especially if we're loading it. And then lots of motion into the hip. One way to explain it to some people that have a little trouble with the idea of the motion is, imagine you're holding a bunch of groceries and your car door is open and you need to close the car door, you're just kind of shooting your butt back into the car door. So that's kind of that hip hinge.
Best times to do it, right? Washing your hands, doing laundry. There's all sorts of things at home where people...
Brushing your teeth, you get that kind of bent over.
Yep.
Where it's very easy to bend at your lumbar. That's a motion that we don't want to do very much, or
as little as we can help it.
Yep. So give that a try. If you find yourself having low back pain, it's a good. Takes a lot of repetitions to get this down, and we're trying to relearn a movement pattern. So it's not one or two times and it's done. It just takes a lot of effort to relearn a movement pattern. But it can be done, and then you can move better, which will hopefully keep you out of pain a lot more. So if you think this video was helpful, please like and share it with a friend or family that might benefit from it. Once again, I'm Dr. Dustin from Chiropractic in Cottage Grove, Minnesota.
And I am Brandon from Twin Cities Movement in Uptown.
All right. Thanks.